Harvard and IronDPC.com. I'm going to be going through Dr. Spar's lecture here on the benefits of TRT. I listened to him up in Nashville at the BHRT symposium, and I thought these slides are too good not to share with you all. TRT and ED, we know that testosterone is most known to help with erectile dysfunction. Let's get to some more, I would say, nebulous reasons why you might want to do TRT. So TRT and cognitive function. Improves cognitive function. Reduced risks of Alzheimer's, improved cerebral blood flow. Testosterone cognitive function, more on that. Androgen supplementation in elderly hypogonadal men, improves spatial cognition and verbal fluency. In elderly men without dementia, it may reduce working memory errors. Let's look at more here. Testosterone and Alzheimer's. TRT prevents the production of beta amyloid precursors, protein in men, and this is a marker that they're using to, look for risk of Alzheimer's and known Alzheimer's. Alzheimer's male patients' TRT improved after 1 year of treatment. Control group deteriorated. Testosterone and bone mineral density. TRT improves bone mineral density in older men. Testosterone and body composition. 4 kilogram increase in lean mass in 3 years in older men with T use. Loss of 4.8 kilograms of fat mass in 3 years. Obviously, if you have a personal trainer, these might be, even but further optimized. TRT and blood sugar. Meta-analysis, 3 to 4 studies looking at fasting glucose, insulin, and A1C. Statistically significant decrease in fasting glucose. A1C decreased almost a full point. 40% reduction in number of people progressing to diabetes if you use TRT. Testosterone bone mineral density and metabolic parameters. Significant reduction in A1C. Reduction in waist circumference. Beneficial impact on all these parameters, maybe blood pressure even. TRT and cardiovascular events. Double-blind randomized control trial. 274 frail elderly patients with low T. They were treated for 6 months with testosterone. No serious cardiovascular events with TRT. Physical function and strength improved. Lean body mass improved. These are all positives. Association of testosterone therapy with mortality, myocardial and stroke in men. These are some studies that if you Google, this is what's going to pop up, right? Because they don't want men to have high testosterone. They have these crappy studies everywhere online. And then you have the wonderful New York Times, right? They want men to have low T. You look at the New York Times editors board, they just look low testosterone. And I think there was a YouTube video where they all got their testosterone looked at, and they all had testosterone in the 300s. Yes. FDA cautions about using testosterone products to slow aging. Okay. Does TRT increase cardiovascular disease risk? Here's that study. They had no randomization or placebo. 2 major corrections were published in this article. Well, what did the New York Times report? They don't report the corrections. Nope. Retraction called by 29 societies. Does the New York Times report on that? No. Does TRT increase cardiovascular disease risk? Here's that study that the New York Times likes to post about. Again, no randomization or placebo. No control group. Here's that other one. Let's see. Experts in the present systematic review of meta-analysis does not support a causal role between testosterone and adverse cardiovascular events. Our results are in agreement with a large body of literature for the last 20 years supporting testosterone treatment in hypogonadal men as a valuable strategy in improving a patient's metabolic profile, reducing body fat, and increasing lean body mass, which would ultimately reduce the risk of heart disease. Let's see. Review of all articles from 1940 to 2014 relating to testosterone and cardiovascular disease. Over 200 articles identified. Only 4 articles suggesting increased cardiovascular risk with T. Several dozen studies demonstrated beneficial effects of normalizing testosterone on cardiovascular risk and mortality. Testosterone therapy is associated with reduced obesity, fat mass, and waist circumference, and improves glycemic control. The longest meta-analysis to date showed no increase in cardiovascular risks with testosterone replacement. Now let's look at TRT on mortality. Some observational studies. TRT associated with reduced mortality of 8.4% compared to 19% in the untreated group. The testosterone trials. 7 placebo-controlled double-blind trials. 788 men aged 72. Sexual function trial. T, increased sexual activity, sexual desire, and erectile function. Physical function. Increased distance walked across all T trial participants. Vitality trial. T, improved mood, but not injury. Cognitive function. No change in cognitive function in this trial. Anemia trial. T, increased hemoglobin. Bone trial. T, increased bone mineral density. Coronary vascular trial, T, increased non-calcified plaque volume by CT angio. No increased cardiovascular adverse events in T-groups versus placebo. Let's talk about that atherosclerosis. Randomized placebo-controlled parallel group double-blind trial. Men greater than 60 years old with a morning testosterone about 100 to 400 and a free T of less than 50. 155 TRT versus 151 placebo. The primary measured change in distal right common carotid artery intima media thickness. Secondary, coronary artery calcium score change. Men received 75 milligrams of 1% testosterone gel for 3 years, titrated between 500 and 900 nanograms per deciliter. So that's where they brought their testosterone up. Radiographic and lab measurements every 6 months. No significant association between randomization to testosterone and the rates of intima media thickness, progression, or change in coronary artery calcium scores. So it didn't reverse it. Too bad. But it didn't increase it. Didn't increase your coronary calcium score. TRT and coronary artery disease. 3 RCTs showing TRT improves myocardial ischemia in men with coronary artery disease. Number 46 with chronic stable angina. Use testosterone patch. Significantly increased time to 1 millimeter ST segment depression from baseline versus non-treated. Right, ST segment is an EKG measurement you can read. It's usually a sign of not enough blood flow to the heart. This one, in 1999, 14 men with chronic stable angina underwent ETT with 30 minutes of IV testosterone. Is that what they're talking about here? Skip that one. I don't know what these acronyms mean. TRT and coronary artery disease. Retrospective review. 83,000 men in the VA hospital with low testosterone compared with 44,000 men on TRT who achieved normal follow-up T levels. Men on TRT versus treatment had decreased all-cause mortality, MI, stroke. Treated men with normal follow-up T levels versus treated men who failed to reach normal T levels had decreased all-cause mortality, MI, and stroke. TRT and cardiovascular risk factors, metabolic syndrome, diabetes. Good evidence TRT reduces fat mass in multiple studies. Testosterone and inflammation. Testosterone therapy created a more anti-inflammatory profile. Fewer inflammatory cytokines. More anti-inflammatory cytokines. Lower total cholesterol. Testosterone and inflammation. Inflammation plays a central pathogenic role in the initiation and progression of coronary atheroma and its clinical consequences. Cytokines are the mediators of cellular inflammation and promote local inflammation of the arterial wall, which may lead to vascular smooth muscle apoptosis and degradation of fibrin cap and plaque rupture. This is how we get cardiac disease. We have inflammation. TRT may prevent some of that. Benign prostatic hypertrophy. Multiple studies have failed to demonstrate the exacerbation of voiding symptoms attributed to benign prostatic hypertrophy during testosterone supplementation. Testosterone replacement therapy appears to have little effect on prostate tissue and androgen levels and cellular function and causes no significant adverse effects on the prostate. At the present time, there is no conclusive evidence that testosterone therapy increases the risk of prostate cancer or benign prostatic hyperplasia. No increase in risk of prostate cancer in clinical trials of testosterone supplementation, longitudinal or population-based studies, high-risk population of hypogonadal men receiving testosterone replacement. That's from Dr. Morgenthaler. TRT does not increase the risk of prostate cancer. Analysis of more than 250,000 medical records of mostly white men in Sweden. Men prescribed T for over a year had no overall increased risk of prostate cancer. 38,000 men whose records were examined developed prostate cancer between 2009 and 2012. 284 of these men had prescriptions before diagnosis. 192,838 men did not develop prostate cancer. 1,000 of them used TRT. Long-term reduction in aggressive disease observed only in men after over a year of TRT. Risk of prostate cancer did not differ between dosage forms. TRT in sexual symptoms, TRT in mood. It might improve mood, right? I've seen that happen, personally. Interim conclusions: increased insulin resistance has led to obesity epidemic. Increased environmental toxins has created endocrine disruption leading to inflammation and imbalance. Increased stress cortisol demand has contributed to the obesity epidemic and enhanced hormonal imbalances. Dr. Spars suggested some general recommendations that I always advise: reduce toxin exposure, phthalates, BPA. Reduce inflammation, vitamin D. It's great. Treat the metabolic syndrome as diet, exercise, and T therapy. And that's all we'll have for today on that. Thanks for watching.